If you think about it, your heart is the most incredible engine you'll ever own. It's a pump that works nonstop every single second of your life. But what happens when that amazing pump starts to lose power? When it just can't keep up with what your body needs? Well, that's when you run into a condition we're going to talk about today: congestive heart failure.
So, here's our game plan. First, we're going to get to the heart of the matter, the failing pump itself. Then, we'll look at the two main ways it can fail. After that, we'll see how problems on the left side of the heart create a domino effect that hits the right side. And finally, we'll wrap up with how we can actually fight back.
All right, let's dive right in. The whole issue of heart failure, when you strip it all away, is a classic problem of supply and demand. Your body is demanding blood, and the heart is struggling to supply it. So, at its core, heart failure just means the heart can't pump out enough blood to keep the rest of the body happy. And because that forward flow is weak, you get a backup. It's kind of like a major traffic jam on the highway. Blood gets backed up in the system, and that leads to fluid building up or congesting in places it shouldn't be, like your lungs or your legs. And that right there is why we so often call it congestive heart failure. Now, you might think a failing pump is just, well, a failing pump, but it's actually a little more specific than that. When we talk about the heart, it can fail in one of two very distinct ways. It can be a pumping problem, or it can be a filling problem. So on one hand, you have systolic failure. That's your classic pumping problem. The heart muscle is just too weak to give a good, strong squeeze. But then you have diastolic failure. This one's different. It's a filling problem. The muscle might actually be really strong, but it's become so thick and stiff that it can't relax properly to let enough blood in. Either way, the end result is the same. Not enough blood gets pumped out to the body. So, how do we actually measure that pumping problem, the systolic failure? Well, there's a really important number we use called the ejection fraction. Think of it as a report card for how efficiently your heart is doing its job. Let's break it down with a simple example. Imagine your left ventricle holds about 110 milliliters of blood when it's totally full. Okay, now with one healthy pump, it pushes out, say, 70 milliliters of that. All you do is divide the amount pumped out by the total amount. So 70 divided by 110. That gives you about 0.64 or 64%. That percentage right there, that's your ejection fraction. So what's a good score on this report card? Well, anything over 50% is considered normal and healthy. If you're in that 40 to 50% range, things are borderline. But once that number drops below 40%, that's a clear red flag for systolic heart failure. It means the pump just isn't strong enough anymore. So, what does your body do when it senses the pump is getting weak? Well, it has this really clever little trick called the Frank-Starling mechanism. It tries to fill the heart with more blood to stretch out the muscle walls. The best analogy is a rubber band. The more you stretch a rubber band, the harder it snaps back, right? The body is hoping that extra stretch will force the heart into a stronger contraction. It's a brilliant short-term fix, but it's not a solution that can last forever. Okay, let's move on. Because heart failure usually doesn't just happen to the whole heart at once. It's a chain reaction. And most of the time, it starts on one side, specifically the left side. You can think of it as the very first domino to fall. And here's how that first domino usually tips over. It can often start with something as common as chronic high blood pressure. To push against that constant high pressure, the left ventricle muscle has to work harder, so it bulks up, just like a bicep at the gym. But here's the catch. This bigger muscle needs way more oxygen. At the same time, because it's so bulky, it can actually start to squeeze its own blood supply arteries. So you've got more demand for oxygen, but less supply. That's a recipe for a weakened muscle. And once the pump weakens, that's when blood starts to back up, creating that traffic jam right in the lungs. Now, besides high blood pressure, a few other things can kick this off. Ischemic heart disease, which is basically plaque clogging the heart's own fuel lines, is a huge one. Then there's dilated cardiopathy, where the heart walls get all stretched out, thin, and floppy. And you can also have something called aortic stenosis. Think of it like the main exit door from the heart being jammed, forcing the muscle to work way too hard just to get blood out. So what happens next? Remember that traffic jam in the lungs? It doesn't just stay there. All that backed up pressure now makes it incredibly hard for the right side of the heart to do its job. The domino effect keeps on going. Okay, let's put these two side by sides because this is really key. When the left side fails, the backup is in the lungs. That's why you get symptoms like shortness of breath. But when the right side fails, the backup is in the rest of the body's veins. This leads to totally different symptoms, like swollen legs and those big bulging veins in the neck. And here's the kicker. What's the number one cause of right-sided heart failure? Yep, left-sided heart failure. And the signs of this body-wide backup are often things you can actually see. That jugular vein in the neck can start to bulge out. That's JVD. All that extra fluid can pool in the abdomen, which can make the liver and spleen swell up and become tender. And then there's the classic one, pitting edema. That's when you press a finger into someone's swollen leg, and when you pull it away, an actual pit or indent is left behind for a few seconds. Now, I should mention one special case. It is possible for the right side of the heart to fail all on its own, without the left side failing first. When this happens because of a serious chronic lung disease, we give it a special name, cor pulmonale. So we've seen how the pump can get weak and how the problem can cascade from one side to the other. Now for the most important part. Let's get into our final section and see what we can actually do to fight back. This is really the million-dollar question, isn't it? When the body's most important pump is in trouble, what tools do we have in our toolbox to help ease its burden and get things working better? Well, the strategy is really multi-layered. Medications are usually step one. Things like ACE inhibitors help relax the blood vessels so the heart doesn't have to push so hard. And diuretics, or water pills, help the body get rid of all that extra congested fluid. For some people, we can use special pacemakers to help the heart's contractions get back in sync. For really severe cases, there are even mechanical pumps called VADs that can be implanted to help do the heart's job. And, of course, as a last resort for end-stage failure, a heart transplant is the final option. And that kind of brings us full circle. When you really understand the mechanics of all this, the pumping, the filling, the whole domino effect, it just gives you a whole new level of respect for the incredible job our heart does day in and day out. I mean, it is the one engine in our entire body that never, ever gets a break. And that really leaves you with a big question. How can we all do a better job of supporting it?